Welcome to this training program by BeWell-T08. Shaping the health and care workforce of tomorrow. The BeWell project addresses the need to prepare the health and care workforce for green and digital solutions introduced in the European health and care systems to ensure they can respond to current and future challenges. Hi. In this course, we will talk about telehealth, why it is important, what is needed to implement it, and, above all, how to do it with practical examples and demos. So let's start. In this course we will meet with those who have already done it in their hospital to better understand the optimal path for implementing an efficient and effective telehealth service. Understanding the main characteristics and requirements for implementing telehealth services in a hospital setting. These are the aims and objectives for the modules. Module 1 – Introduction to Telehealth. Module 2 – Building a Telehealth Clinic. Module 3 – Step-by-step actions to implement telehealth. Module 4 – Implementation. So, we can start with the first module. The ongoing evolution of demographic dynamics and the resulting changes in the healthcare needs of the population, with an increasing number of elderly individuals and chronic conditions, necessitate a structural and organizational redesign of the service network, especially with the aim of strengthening the territorial scope of care. Technological innovation can contribute to the reorganization of healthcare, particularly by supporting the shift of healthcare focus from hospitals to the community through innovative care models centered around the individual, facilitating access to services nationwide. The delivery methods enabled by telehealth for healthcare and social care services are crucial in this regard, ensuring equity in access to care in remote areas, supporting chronic disease management, providing access to specialized care, facilitating continuity of care through multidisciplinary collaboration, and serving as a vital resource for emergency services. Numerous national telehealth initiatives exist, but often they are limited to experimentation, prototypes, and projects characterized by limited case studies and high initiative mortality rates. In light of this non-organic proliferation of telehealth services, it is necessary to establish a shared governance model for telehealth initiatives, with the central focus on the specific knowledge of the healthcare sector. Therefore, harmonization of telehealth guidelines and application models is required to ensure interoperability of telehealth services and facilitate the transition from an experimental approach to a structured logic of widespread telehealth service utilization. The development of telehealth tools allows for finding new solutions to traditional medical problems and creates new opportunities for improving healthcare services through increased collaboration among various healthcare professionals involved and patients. The following are the main motivations and expected benefits driving the development and adoption of telehealth techniques and tools. Equity of access to healthcare. The use of telehealth can greatly increase equity of access to qualified healthcare in remote areas. Think of the sea, small islands, mountains, or simply rural areas with limited connections to reference cities. Telehealth can also contribute to improving healthcare in correctional facilities, which face challenges and additional costs due to transportation logistics, difficult emergency management, long wait times for diagnostic specialist assessments, and limited preventive diagnosis activities. Improved quality of care by ensuring continuity of care. Telehealth aimed at bringing medical services directly to the patient's home, without the need for the doctor to leave their office or the patient to travel, is closely related to this motivation. The care of chronic diseases can be a priority area for the application of telehealth models. Telemonitoring can enhance the quality of life for chronic patients through self-management and remote monitoring solutions, including early discharge from hospitals. Better effectiveness and efficiency, the challenge faced by healthcare systems in the coming years, associated with an aging population and the prevalence of chronic diseases over acute conditions, must also be addressed through better utilization of the system supported by information and communication technology. The introduction of telehealth as an innovative organizational approach immediately improves communication among different stakeholders and guides providers toward appropriate resource utilization, reducing risks associated with complications, hospitalization, waiting times, and optimizing resource utilization. Timely and synchronous information availability also offers the opportunity to measure and evaluate healthcare processes using process and outcome indicators. Telehealth tools, for example, can support pharmacotherapy to improve medication compliance. There are devices and systems available to assist patients in the therapeutic process and improve outcomes while reducing adverse drug events. Cost containment, telehealth should no longer be considered as a separate sector but rather as a specialization within the broader field of electronic health. Electronic health encompasses the use of ICT to support the entire range of operational functions and processes in the healthcare sector, with the electronic health record representing the most advanced and innovative aspect that is progressively impacting the European, national, and regional contexts. One of the advantages of new telehealth-based organizational models is the potential rationalization of socio-health processes, which can have an impact on containing healthcare costs and reducing the social cost of illnesses. Impact of chronic diseases on the national healthcare system. The rate of chronic disease and the resources required for its management strain the healthcare system due to the resources and costs associated with care. Chronic diseases, including cancer, diabetes, hypertension, stroke, heart disease, respiratory diseases, arthritis, obesity, and oral diseases, can lead to hospitalization, long-term disability, reduced quality of life, and death. In fact, persistent conditions are the nation's leading cause of death and disability. The physical burdens of chronic disease can vary from pain to mental health issues surrounding the illness. Depending on the type of chronic disease, these physical burdens may be addressed through medications, therapies, and lifestyle changes. When a patient has more than one chronic condition, for example, diabetes, hypertension, and mood disorders, treatment can be difficult to manage. Treatment strategies or drug regimens may be similar, but can be very different, and one chronic condition may be better managed than the others. An average of 75% of all healthcare spending is allotted to chronic illnesses. According to different researchers, both direct and indirect are immense. Direct costs are those attributed to the prescriptions, procedures, and other healthcare products and services needed to treat individuals with chronic diseases. Indirect costs are those associated with the impacts of chronic disease in other realms of life, such as effects on employment, mobility, and other factors associated with well-being. Chronic disease and multimorbidity management is a challenge for healthcare providers. This has its roots in patient characteristics, the overall health system, and healthcare providers themselves. Structural changes need to be implemented at different levels: medical education, health systems, adapted guidelines, leading to an overall environment that favors the development of the therapeutic relationship. After this introduction, we are ready to tackle all the most important aspects and decisive challenges to launch an excellent telehealth service in our hospital. Until the next lesson, goodbye.